Since 2007, Dr. Sarah Reardon has been caring for people's pelvic floors as a doctor of physical therapy and board certified pelvic floor physical therapist. She is the founder of the V Hive, an online, on demand pelvic floor workout platform for pregnancy, postpartum, menopause, painful sex, and pelvic floor strengthening. As the Vagina Whisperer on Instagram and TikTok, she has hundreds of thousands of followers. Sarah lives in her hometown, New Orleans, Louisiana, with her husband and two children. Floored, a complete guide to women's pelvic floor health at every age and stage, is her first book.
Woohoo!
Yay! Congratulations! It's such a
Thanks
big
so much.
deal to write a book.
Yeah, thank you so much for having me. I feel like the past 2 years have been definitely in book world, but it's been really wonderful and exciting. So I'm happy to be here.
We are thrilled to have you. My
Yes.
gosh, I spent some time on your website and okay, immediately took the quiz. I was like, yes, me. I will take the quiz. And I was laughing because when you start going through, you actually talk in your website about so many different
Right.
stages of the pelvic floor and the whole body of the woman's health. And I think it's so wonderful that it's not just one stage in life. So if you're about to get pregnant, if you're about to have a C-section, if you're menopausal, all walks of life can find information and support within your website and all of your Instagram posts. So thank you for doing that so much.
That's so great to hear. And I think that's one of the biggest things is I've been in this field for 18 years as a pelvic floor physical therapist. And so often people think, oh, I think that's for people who have babies or they're postpartum or they're aging. And I'm like, no, you can have pelvic floor issues at any age and stage. And when you don't realize this treatment is available, you can often suffer in silence for so long and then your symptoms get worse. So I really am just a huge proponent of I went wide. I went wide with the book. I went wide with my website of let's give women information at every age and stage so they feel really empowered on how to take care of their body and their pelvic floor no matter where they are.
Absolutely. And so let's back up a little bit. How did you get into this whole field? Because this is a very niche genre. I've actually worked with a pelvic floor therapist who went up my vagina, and holy God,
That's
those
right.
but helped so much. So let's go there. How did you get
Okay.
into that?
So I went to graduate school as a pelvic floor physical therapist. I'm sorry, I went to graduate school as a physical therapist to get my doctorate degree. And during that time, I was at WashU in St. Louis. I have a professor who she's still my mentor to this day. And she gave a 2 week lecture on what was then called women's health, is now called pelvic health. And it was just talking about your body as a woman, like pregnancy, birth, exercise, peeing, pooping. And I'm thinking, I've never heard of these muscles. This is really interesting to learn more about my own body. And then I did a clinical rotation in graduate school working at the University of Michigan in Ann Arbor for a semester. And I just loved helping other women understand their bodies better and get help with things like urinary leakage, painful sex, constipation that they had never talked to anybody about, and to create a space where they felt really comfortable, where they felt less alone. Because I said, oh, the patient before you and the patient after you, they all have similar situations and symptoms. And then to be able to help them get relief was just so incredibly rewarding. And I jumped right into it after graduate school. I've done this for 18 years. It's the only type of physical therapy that I've practiced. And in 2017, I started my Instagram account, The Vagina Whisperer, to just help my girlfriends going through pregnancy and birth with pelvic floor tips. And then it just really has exploded since then. So it's been a really incredible journey.
Wow. And I went on your Instagram, just I was familiar with it and also because of the name similarity. So Jen and I are intuitives. So when we talked about, and it surprised us more than it would have surprised anybody else about feeling that desire of, oh, I think we're supposed to do a podcast about this because we were talking about sex or body parts and not enough people talk about this. And intuitively, it came to us, both of us, about vagina.
Spring.
And then I was like, oh, and we put a bunch of things out there, established the name, created a website. And then I was like, I never even thought we should look this up. And then I was like, oh no, I hope she doesn't
I know.
think we're like,
We didn't
you know,
we didn't want
infringing on your
anybody
name.
exactly. We didn't want anybody to be like, oh my God, those
Yeah.
bitches.
Exactly.
Because it was very much, we don't want to be the whisperer. Like, you're the whisperer. You're the
Yeah,
one who knows the inside and out. We actually need a
literally.
lesson on the pelvic floor muscles and all of that. We do. We want you to talk about that
Yes.
in detail. What is it? What parts of this is what's included? But both Noelle and I were like, oh my gosh, no, is it the labia? What's the labia? What's this?
Oh,
So we're definitely not whisperers like you are. We just simply like to talk to them. So we whisper to them. No,
I
and they
love
whisper
that.
back to us.
they do.
Exactly. And I think that's the thing is that this was just a nickname that my girlfriends gave me. I started the account really just for my group of friends, and they are the ones who called me the Vagina Whisperer as a pelvic floor therapist.
I
And
love
then
that.
it just became this, a joke became a brand, and then a brand became a business, and it's now a book. And I think it's really cool to see how these interests and these passions that we have can develop into something that really helps so many women because we other people don't know what's out there. Like they don't know what you do, they don't know what I do, but it's all pieces of a puzzle. Like I don't think that there's just a physical component to working with the pelvic floor. There's so many other aspects, psychosocial, emotional, intuitiveness. There's just so many pieces that I don't think are addressed in the current medical world. And so I think it's nice to have these different groups and people, specialties come work together. The pelvic floor is a basket of muscles, and as a physical therapist, we work with muscles and tissues and nerves, and I work with the muscles and tissues and nerves in the pelvic region that play a role with holding in bowel movements, holding in urination, relaxing to help you empty, with vaginal intercourse, vaginal birth, menstruation, sexual activity, and then supporting your pelvic organs, supporting your spine, breathing. These muscles play a role in so many things we do day in and day out, yet we never talk about them. And unfortunately, women don't even realize they exist until they start experiencing a problem like leakage, like pain with sex, like prolapse, like back pain. And so, my goal with Floored, my book, is to really give women a manual, a guide to say, this is what's normal for your body, this is what these muscles do. Here are some tips to proactively take care of them and prevent issues. But if you're experiencing issues, here's also a regimen, a protocol to help you start getting support if you don't decide to see a physical therapist or in conjunction with a pelvic floor therapist.
Okay, I'm just going to go there. Do you have an office that you actually do practice at? Because some people are
Yes.
just Instagram. Okay, good. So when someone comes into your,
Clinic.
I was going to say studio, I'm like, nope,
We
it's
call it a
not a
clinic.
studio.
Like a it's
It's
a
a
it's a
it's
it's
a
a clinic,
medical
yeah.
clinic. It's
Yeah.
actually a legit medical clinic.
Right.
Jeez Louise, sorry. Okay, so when they come into your clinic, good God, walk me through the process. What are you aiming for? And then what would be a step-by-step protocol that you would use to work with individuals?
Absolutely. And I think this is great to talk about because it's really mystical. They're like, how do you
Hmm.
assess the pelvic floor? And what do you wear? And what do we do?
And it's
Uh,
scary, dude. I've done it. It's scary. You're all,
Yeah, I've done
are
it
they
too.
gonna
Yeah.
are they gonna be gentle? Oh my God. You're sweating before you even get in, like you're driving to your appointment and you're soaked. And it's not a hot flash.
Yeah, and I think that's the thing is that it takes so much courage for someone to one, recognize that they need help, two, ask for it, and then three, attend. And so I really give women and my patients so much grace and gratitude and support because I'm like, what you're doing is not easy. Unfortunately, because it's been persistent, it's scary because we don't know what to expect. It can often be complicated because there could be different layers to what you're experiencing or why you've experienced it. And people always say, you're so open on social media and you talk about your own troubles or your own families. I'm like, if I'm asking my patients to be
Mhm.
vulnerable with me and share the intimate details of their life, I want them to feel safe. I want them to feel like I'm no different than any other woman out there. And so I think that it's really just to help disarm the situation. But back to your question, when someone comes in, it's one-on-one with a physical therapist. To be a pelvic floor physical therapist, you do have to have specialized training. You have to go through specialized courses. I have a board certification I sit for every 10 years. So it's a little bit a higher standard that I'm held to with a board certification than if you're entry level, which we all start off entry level, but we're trained on how to do these examinations. And you sit down one on one with a therapist and you just talk for a little bit. We ask questions about You may be coming in for painful sex, but I want to hear, Jen, about your bowel movements, about your birth history, about your previous menstrual cycles, about what you do for work, how you exercise, any history of trauma, just a kind of real overall general picture of your health and your pelvic health. And then I do an external assessment with your clothes on, where I may look at your low back, I may press on some muscles in your glutes, I may check your abdominal wall for tension or scars or weakness. And then I'll step out of the room and I'll say, okay, I want you to get undressed from the waist down. So you'll take off pants or underwear. And you lie on a treatment table covered with a sheet. There's no stirrups or anything. And you're welcome to have another person in the room. You're also welcome to say, I don't want an internal assessment. I'm not comfortable with that. I want to wait till a later time. That's totally fine. But the way that a pelvic floor therapist accesses the pelvic floor muscles is through the vagina or the anus. Most often in females, it's through the vagina. So we insert a gloved, lubricated finger into the vaginal opening, similar to a pelvic exam. And then we ask you to squeeze around my finger, and that helps us assess your muscle strength, to relax so we can assess relaxation, to push or bear down like you're having a bowel movement or giving birth. And that helps us assess like how well the muscles relax, if there's any decreased support or prolapse. And then we press on the muscles on each side, left and right of the pelvis, to see if there's tension or tenderness or pain. And that gives us, along with the symptoms you just talked about, an overall picture of, does this person have pelvic floor muscle tension and they need to work on relaxation? Do they have weakness and they need to work on strengthening? Or do they have both? Is there a coordination issue, or is there tension and weakness? And that gives us an idea of which kind of pathway or protocol to walk down. And then we work on massage, stretching, exercises, posture modifications, breathing, kind of different things over the course of sessions. Or I go through this in the book of what you can also do at home to start self-treatment as well.
Oh, love that. And one of the things I really get from your Instagram account is a lot of not quite DIY, but in your vagina costume, which is adorable, by the way, you share a lot of really practical tips and these
Yeah.
things that you're bringing up of, because I could say I never gave birth. And how would constipation be related to that? But I was having trouble urinating. I was sitting on the toilet for, I was like, I think I've been here for 25 minutes. I've been maybe scrolling or something. And did I
We
even
call that
pee?
the
Like,
office.
It's where
My
we get
my
our best
husband
work
my
done.
husband goes to the office. I'm like, you've been in the office for a long time. You sure you don't have hemorrhoids? Okay, sorry, go ahead. I
but
digress.
it's really helpful to know because you don't really know. I had no concept of pelvic floor beforehand, and on your Instagram account, I've really learned a lot.
Oh,
Like even
good.
using a squatty potty, which I'm a big believer in as well, for urination and the breathing. So
Yeah.
ever since I've been really diving into your Instagram account, I was like, oh no, like I'm holding my breath to urinate. So
Oh,
I'm
yeah.
pressing, I'm putting pressure on, and I really, so now I'm paying attention and I don't know how to urinate without holding my breath. So I'm practicing. So
I
thank you
love that.
for
No,
all
it's
those
so good.
tips.
And it's one of those things that when I was pregnant and I had already been practicing for 10 years and I felt really prepared and educated going into pregnancy and birth. And I'm thinking, why doesn't everyone have this information? Why did I just pick this field and I got lucky and my vagina got lucky that I know this information, but I feel like everyone should know this
Yeah.
information. And why isn't that happening? And that was really the impetus for me starting the account, along with kind of some other, I think, challenging patients I saw that I felt like if they would have known this sooner, maybe they could have had some preventative action instead of going through the trauma that they went through. But I think that, yeah, it's just, Noelle, we should all know these tips, but we're not getting them. And so,
Yeah.
how do we get this information so that women can feel like they better understand their bodies? They feel less in the dark. And they also feel less alone because if I'm posting this about, hey, you can use a squatty potty to pee to help your muscles relax, don't push, take deep breaths, you're not the only one. That's not just for Noelle. I'm so glad it's helpful, but because so many women struggle and they
Mhm.
don't even realize there are solutions for help. And so I'm so glad to hear that's being helpful.
I
Oh,
think a
and
lot of, oh, sorry.
oh, no, go ahead, Jen. Okay, I'll go. And you also brought up in at least one of your videos about how, with our periods and other things, like we're taught to be a bit ashamed of our
Yeah.
vagina or how it smells or anything about it, and nobody wants to hear it. And so it feels a bit like that internalized quiet that we
Yeah.
have about sharing things about our vagina with other women, even, much less like seeking help. And women, we suck at seeking help. A lot of us are helpers and we put everybody and everything else first. And then we're like, I think it's okay. I'll get around to it. And it really sometimes takes a brick or two to fall on us for us to get help. So I love how you are educating people about these little tips. And I'm so excited about your book. I did pre-order it. Again, it's called Floored, and it's
Mhm.
available for pre-order on Amazon. And Sarah gives you little freebies if you pre-order, which is very exciting. And I'm really
Mhm.
looking forward to that, and also giving copies of that to other women I know, especially younger women who are looking at going through childbirth and to avoid some of these problems. Because, yeah, we don't know about it at all. I hadn't even heard of pelvic floor until a few years ago. I think you're spot on with your approach of making it like casual. Hey, I'm showing up in a vagina costume, and then you had a labia costume in some fashion show, which was beautiful. You just make it like fun and inviting, and it's really sweet.
That's so important.
Yeah.
All of it, and that's part of why we do this podcast is so that
Mm,
we just start taking away some of that hindrance. We start taking
Yeah.
away some of that shame, the hesitancy, and we're hoping to empower women to say, "Yeah, I do have painful sex. Yes, I am extremely emotional. Yes, I." Yeah, and what you're doing, Sarah, and that's what I was going to say before you started chatting, Noelle, which pops right into what you were saying is if we don't know we have a problem, we don't
mm,
know that we can even search for a
yeah.
solution. And so I think that's what you're primarily doing is you're helping people understand. And by the way, problem is bad, but if we don't even know that something's wrong, that this isn't typical behavior, that
Yeah.
this isn't typically how your body should feel. Your body should feel alive and healthy and lubricated and happy and present. If you don't know that something off of that little box of loveliness, if you don't know that's not normal, then you don't know. I'll give you a great example. All of a sudden, joint pain. I started waking up in the morning and my hips would just be out of control. And oh my God, I would get out of bed like an old man, like how my dad with Parkinson's used to walk. I'm like, oh, and I'd be all, oh my God, what is going on? And then it got worse. Like I would couldn't sleep on my shoulders. I would have to move around all night because my what's the back of your my tailbone would be sore. Actually, my tailbone is sore right now. Like I can touch it and it's sore. I didn't realize that joint pain is definitely linked with perimenopause.
Yeah.
On your side, I think you said 50%. I've heard up to 80% of women in perimenopause start having extreme joint pain. I thought I was like had bone cancer. Literally.
Oh
I was
my
like, do I have
gosh.
bone cancer? Do I have bone cancer? Because that was the only thing I could think of because no one had ever said to me that 50 to 80% of women in your age group will have joint pain
Yeah.
because their estrogen and testosterone levels are changing.
Yeah. What's
What the
interesting,
F?
and
I'm sorry to say that.
no, you just say it louder. I think that, yeah, yes to all of these things. And I think that I always tell people, they're like, oh gosh, your book has so much in it. And go to the chapter you need, whether it's
Yes.
the one on pain that has tailbone pain information, whether the one it's peeing and it talks about how to pee properly. But read the first chapter and the last chapter because the first chapter talks about how we got here. And there has been this narrative that we need to be ashamed of a certain part of our body. And we don't say that, but it's in the way that we are all brought up. So it's when you get your period and all you get is a brochure and a box of pads. It's when you have to wrap something around your waist at school because you've bled through. It's because you skip school and practices because you are in so much pain because of your periods, which period pain is not normal and people don't even know that. It's when over 40% of high school female athletes leak urine. So as early as being a teenager, you're wearing black leggings because you might leak on colored tights. And when you have sex, you're taught that like this is it's only supposed to be pleasurable. So if it's not, which 1 in 3 women have pain with sex at some point in their lifetime, you feel like something's wrong with you. And so I
Mhm.
think that medical providers are never asking these questions. And therefore, we don't even know that they're problems. And if we do have problems with them, we don't, one, know where to go to for help. And two, we've never talked about them. So we're so uncomfortable addressing this part of our body. And it's really been me being in this field for 18 years. It's not like I was a vagina warrior in my 20s. I was just like, I want to understand my own body better. And then when you've worked with tens of thousands of vulvas, you're like, okay, this is just a body part, like a foot
Mm,
or an ankle or a knee. why are we treating it any differently than that? And I'm raising two boys, and one of my girlfriends, her daughter, who's about the same age as my kids, was like, Aunt Sarah, you're the vagina whisperer. And I said, yeah, sweetie, I am. She goes, and you don't have daughters. And I said, no, I don't. And she goes, that's a missed opportunity for a girl. And
Oh.
how sweet is that? And I thought, yes, but also I have two boys who know more about the female body than probably any other two young boys. And they know what a period is. They like see tampons coming out of my vulva and they're like, Mommy, what's that string? And why do you have that? And why do I have a penis and you don't? And just having these open conversations. And my husband's one, is it too much? And I was like, I don't know. I guess we'll figure that out later. But
There's in the handbook on it.
I also think if kids can't be curious and ask questions about their bodies, then we're not curious adults. We don't talk about it. So it's really changing the narrative of the next generation or for the next generation of, hey, let's just talk about these things like every other part of our body. And then it cracks the door open for them to come to us if they have questions later down the line.
Do you know the attachment nerd, Eli? Yeah, check her out. She's very open about these are the words we use. This is how
Oh,
we talk
yes.
about it. When a new babysitter comes in, we say, "Hello, we use words in this household." So, the vulva, the penis, the anus, we don't poop out of our butthole. We poop out of our anus. And you can tell immediately if someone is very uncomfortable, but you can also, and this is total off topic, but when you have a new babysitter, you can also, you say we talk openly about it. So if anything happens to an anus or a penis or a vagina, we're very open about talking about it in this household. And you can get ahead of sexual perpetrators. That's her genre right there, making sure that we're preparing our children. But if they've never seen a string hanging out of mommy, and the first time they ever see it, they're going to be like, "God, something's wrong." And so you're creating an opportunity that everything is open for discussion. And that's really what you're showing us all is it's all open for discussion and solution.
And
It
not
is.
to be
And
weird about it.
Yeah.
yeah, and
So,
it's not that it's always comfortable. I talk about these things with adults all day, but when it comes to talking with my kids, I'm like, okay, this is tough. It's not always easy, but it also has to be done. Because I'm like, if they don't come to me, they're going to go to the internet, they're going to go to social media, and they probably still will go to those places. I at least just want us to move the needle. I just think that we talked about it none when I was growing up. I'm 42. A lot of it was cultural, a lot of it was societal. It was just the times, but we've got to move forward from there. We can't have the same thing. And I think when you've been in my field or my practice as long as you have, and you have so many women coming in, and the number one thing that they said is like, why didn't I know about this sooner? Why
Mm.
didn't my doctor tell me sooner?
mhm.
I wish I would have known earlier. And I'm thinking, how can we keep hearing that and not try to change that? And just feel like we're doing damage control after they have problems instead of helping them either sooner or preventing the problems in best case scenario.
Yeah. So what are some of the major things that women and men should know? Because I do know that I call her the vagina doctor, my PT down there that does pelvic floor. And there's also male pelvic
Yes.
floor and they
Yeah.
go in through the anus
Right.
and that is but so it is men and women primarily. We can chat women right now because I think that's our audience. But yeah, talk with us about what are some of the main things that you think women should know. And let's more focus on post childbirth forward.
Okay. So one thing I think just to put it out there is that everyone has a pelvic floor, all genders, and anyone can have pelvic floor issues. It can be kids, trans folks, males, females, everyone. And I think the other thing is people often think that the pelvic floor can only be weak and therefore that causes leakage or pain, but actually these muscles can be tense. And I think 50% of the time, if not more, I see women who have pelvic floor tension, which can contribute to pain, incomplete bladder emptying, constipation, straining, hard time starting your stool, your bladder or bowel. So all of tailbone pain, all of these things.
I'm having a
With
hot
that being
flash, so just
said,
ignore me. I'm having a hot
it's
flash.
okay, fan
Mm.
away. I would say the most common symptoms that I see women present with are urinary leakage. And we have this hammock of muscles that support our bladder, our bowels, our uterus. And that hammock gets weaker with pushing during childbirth, with pregnancy, with high impact exercise like running, jumping, heavy lifting. with straining during bowel movements and urination, and then with aging because of our changes in estrogen and testosterone and collagen. So,
Mhm.
urinary leakage, pelvic organ prolapse, which is when your organs aren't as supported by these muscles, so that hammock gets weak and then the organs push into the vagina. So, it feels like there's a bulge in your vagina. It feels like something's falling out. It feels like you have to push to pee or poop. Pain
I
with
had to look
sex,
that up. I had to look that up. I had no idea
pelvic
what
organ
that
prolapse.
was.
If
You
you walk
saying it
in,
on your website, and I was like, and then an image popped up, and I was like,
yeah, it sounds scary and it looks scary, but really what it is, it's weakness of the muscles and
okay.
tissues. And but if you walk into a gynecologist, often 50% of the women after giving birth, anytime after, 50% of them will have pelvic organ prolapse because those muscles aren't as
Wow.
supportive as they used to be. They've just been stretched out and lengthened. And because in our country we don't have postpartum rehab and physical therapy for women after giving birth or with aging, it will persist. And then pain with sex is another really common one. Typically, tight muscles, nerve pain, vaginal dryness from decreased estrogen. These are all really common issues that can lead to painful sex as well. And the stats are astounding. More
Hmm.
women experience urinary leakage than osteoporosis, high blood pressure, and high cholesterol and diabetes. So I'm
Oh
like,
my
we
goodness.
see dozens of commercials with medications to help these issues. We see walks and campaigns and conferences and months focused on these women's health issues, which are so important, but more women experience urinary leakage, yet women are less likely to get treatment for pelvic floor disorders than any of those other dysfunctions. So it's out there. It exists. And we need to keep having these conversations so that women can get the support they need instead of ending up in diapers or liners or spending gobs of money on treatments and supplies.
Yeah, I thought it was my mom was just never. My mom and double negative here. My mom never not has a pad in, a liner in.
Oh
It's
wow.
been there for years.
Right.
She just buys them. So yeah, I didn't know that. Wow, that's fascinating. Let's talk about leakage. What are some at-home remedies that some woman who's listening right now could do? Maybe two things that they could do once a day.
So the first thing I think is look at how you're peeing. So as Noelle mentioned earlier, you might have this tendency to push when you pee. You either feel like you can't start your bladder, you feel like your stream is really weak, or you feel like you can't empty well, or you're just in a hurry. We love to be efficient. We love to be multitasking and moving on to the next thing. So we push and try to power pee as quickly as possible. And that can actually weaken your muscles over time, leading to more leakage and more prolapse. I also tell you to sit down when you pee. So instead of hovering over a toilet, sit, put your feet flat on the ground, or you can use a squatty potty or a stool underneath your feet, but sit down, lean forward, take some big deep breaths, and that helps your urinary sphincter relax. And don't push, just let your stream trickle out. If you feel like you don't empty completely by the end, shake your hips a little bit and then stand up and sit down again. And that's called double voiding. And so if a little bit extra comes out, that second void, great, but don't
Hmm.
push. And then you just wipe and walk away. So when you pee 6 or 8 times a day and you're doing it incorrectly by pushing or hovering, or you could actually be just over time cumulatively weakening your pelvic floor muscles. The other thing I tell people is only pee when you have the urge to go. Don't just in case pee. That will actually, if you pee every time you leave the house or you arrive somewhere else, you pass the bathroom. I know we're all raising our hands. Your bladder can shrink, and that will make you have to pee more frequently all the time. And then you feel like you can't make it to the bathroom in time, which can also lead to urgency and leakage. So let your bladder fill completely. The normal amount or frequency to void or pee is every 2 to 4 hours during the day. So if you're going more frequently than that, try to push deeper into that 2 hour mark. I give a lot of strategies on how to do this in the book, but it will help your bladder expand so that you don't have this strong urgency and then can't make it to the bathroom in time.
And yet there's the opposite, 'cause I also know that there are girls in high school, let's just say, that I know a few that won't pee all day because they
Right.
don't want to go into that bathroom.
So pee when
And
you
so,
have the urge to go.
mhm,
So
yeah.
if you have the urge, you should go. And when you over tighten your muscles to hold in your pee, they get too tense. And that
Hmm.
means when you finally do go, you have a hard time relaxing. Like when I am on the beach and I'm drinking and drinking water and I'm out there for hours, I'm like, oh, I really
You're
just don't
only
want to.
drinking water? You're only
Only
drinking
drinking water,
water?
only
Wow,
water.
I'm
No
so impressed.
champagne, no cocktails,
I
nothing.
just want, I was like, you're drinking water. I'm like, wow, impressive.
And you hold your bladder, and then how many of us like go into the ocean, you try to pee, and it's so hard. You have to really work to relax your muscles. That's what happens when you delay, and then you push to pee, and it weakens your muscles. So pee when you have the urge to go. And then you can also, I tell people to insert a bladder support if you leak when you play tennis or run or jump or you're coughing, insert a tampon in the vagina and that kind of supports the bladder a little bit. You don't need to do this all the time, but while you're strengthening or working on training your muscles, it's a great way to give a little bit of extra support so that if you're coughing or jumping, you don't have that leakage occur.
So the vaginal support supports the
Yes,
bladder. Interesting.
correct. Yes.
I guess yeah, good point. See, we're learning
Yeah.
anatomy here. Love it.
Yeah.
So I'd love to share a more woo-woo tip
Yeah.
about when you're like, and I am very much guilty of the just in case peer, or I'm about to leave the house. And that was one of the biggest shocks, I think, from the pelvic floor therapist I worked with, is she was basically saying, I'm like wearing out my bladder. And I was like, what are you talking about? I drink a lot of tea. You don't understand. So I've made a lot of lifestyle changes. But when I am really feeling connected to myself and I want to really empty and I know that I didn't, I'll actually talk to my bladder and bladder sphincter and say, please, I just did this last night. Anything you can release would be appreciated. And I give it a moment. And a lot of times it works. But I never heard of your tip. I'm going to try that also. Depending on your perspective, maybe try both.
I love that. Try it all. I think that these are
Yes.
great things. If that helps, there's a nervous system component to this. So if you have a very upregulated nervous system, who doesn't in this day and age have sit too long, we're on screens too long, we don't exercise enough, we're anxious, we're overstimulated. I don't know a human that is living right now that is not in that state. And our bodies hold on to that tension. So when you finally go to sit down, your muscles need to relax. And not everyone, this is an amazing skill that you have, Noelle, because I always say we can't just talk to our pelvic floors, but you can, and you can connect and say it's either taking deep breaths, leaning forward, breathing, talking, anything that's going to help your nervous system and your muscles relax is going to help you be a more effective peer and pooper.
Let's talk about sex, baby. I'm such an 80s baby. I'm not a
Love
baby.
it.
No, I'm not an 80s baby. Let's just make that very clear. You're an 80 baby. I'm not an 80. I was like, no, you said your age. And I was like, oh, I remember those good old days. No, so yeah, let's transition from peeing and pooping to sex. And I wanted to give you a shout out on your TEDx talk about, you said it. I can't exactly remember how you said it, but basically, so many people were and still are, when they talk about sex or when they talk about the vagina or all of these parts, they make it into a joke. They make it into something funny. They laugh it off. And you're very good about saying, Nope, this isn't a laughing matter. We need to talk about it. We need to be open about it. And it's really important. So I love that. Even though I do tend to make a lot of jokes, I was not joking about that hot flash right there. And now I'm freezing. You know how that works. Hot flash,
Hmm.
freezing, hot flash, freezing. But it's not a joke. And so painful sex, and that's one of the main reasons actually Noelle and I started the podcast, was to start talking openly about painful sex.
Yeah,
And what can we do to shift that? Because it isn't typical. It isn't okay to just know that every time I'm going to have sex with my partner, it's going to hurt. No, that's not how it
right.
should be. So let's go there. What do you know about that, Sarah?
A
Dr. Sarah.
lot.
We should be called to Dr.
No,
Reardon.
please call me Sarah. Oh, no, that's so uncomfortable for
Dr.
me. Yeah.
Reardon. But you've earned it.
Sarah.
You should. You earned it.
Really prefer Sarah, but thank
Okay.
you.
All right.
So yes, pain with sex can occur the first time you attempt sex, after giving birth, after trauma, with aging, because the tissue changes from lower estrogen levels, when you're on hormonal birth control, when you're breastfeeding or pumping. I mean, your hormones influence your tissues and tension influences your muscles. These are muscles like any other muscle in your body. And you can get muscles in your neck and muscle tension in your neck and shoulders, like I do from hovering over my computer or being really stressed out. And then I get knots in my shoulders and I get headaches. The same thing can happen in your pelvic floor where you're holding tension in the area. They're tight muscles. It can be from exercising, it can be from crossing your legs, whatever the case may be. And these muscles close the vaginal opening, and they're also part of the deeper bowl of pelvic floor muscles at the end of the vagina. So oftentimes if people are attempting sex and it feels like something's hitting a wall, or they can't get a penis, a dildo, even a tampon, a speculum, or a finger in the vagina, It's the outer third of the pelvic floor muscles that close the vaginal opening that are tight and in spasm. And what happens is that it's painful, but when something's painful, what does our body do? It tightens up.
Yeah.
And that causes more pain. And then we anticipate the pain when we try again.
Mhm.
And that causes more. And
Mm.
that, so it's like you get in this cycle of pain, tension, anxiety, and that contributes to the difficulty relaxing. And it used to be attributed to, oh, you're just anxious, you need to relax. It's not that simple when it becomes this
Mhm.
kind of complex cycle. When you have pain with deeper insertion with sexual intercourse, vaginal intercourse, that deeper basket of muscles also attached to the hip, and they can feel like something's tender or bruisey, like your partner's hitting something, like a deep hip pain. And that's just muscles and tissue. And so when we're able to release these muscles with internal vaginal massage, with stretching to the hips, I do this technique called dry needling in my clinic that releases the hip muscles and the glutes deeper. You can also do it to the pelvic floor using vaginal dilators to help relax the opening, using a trigger point wand internally to help release tight muscles and tissues. All of these things just soften these muscles, and we want to make touch and insertion non-painful. You shouldn't be pushing into pain in your therapy visits, in your home treatment. It should feel like maybe tender, bruisey, or sensitive. But when we have pain, we over respond and guard, and that we want just underneath that. But when we can introduce touch to this area that's not painful, our kind of nervous system start to rewire. So we start guarding less, and then we have less tension, we have less anxiety. And so it's this kind of complex cycle of unwinding the body and the mind together. But it can also just be a lack of lubrication, which happens when you're menopausal or perimenopausal, when you're, again, postpartum and breastfeeding or lactating, when you're on hormonal birth control. So, you want to use a good lubricant. I prefer something that's water soluble because it doesn't hang out on the tissues, but you may have to reapply it. Doing some deep breathing and stretching routines before sexual activity, thinking about stretching before you run a race, not pushing into pain. So there's a lot of techniques and tools and things I give you in the book to do self massage, or you can go see a therapist for this. And then also recognizing that pain is information from your body, that something's not quite right, but it can literally be as simple as a muscle spasm. And then once it's released, sex is enjoyable. And or it can be scar tissue. We also see a lot of women with scar tissue at the opening post-birth, post-vaginal birth.
Oh, wow.
Think about this, it's not rocket science. It's just not talked about. And it's
Yeah.
really simple to treat and overcome.
So you have on your website the vaginal wand.
Yeah.
It's like
An S
that.
curve, yeah.
Big.
So it's really fascinating because another physical pelvic floor therapist, a gentleman, came up with this device, and it's supposed to almost mimic like your therapist's finger going into the vaginal
It
opening and
looks like
pressing on the
that.
muscles.
Yeah.
And I have one in my nightstand. So if I'm like doing heavier workouts or I get a lot of hip tension, I can feel like, oh my gosh, it's like painful on my left side when I'm having sex. And I just insert that wand and kind of press on the muscles, and I take some big deep breaths, and it's so quick and effective. And I show you how to use it in the book. You can go see a therapist who trains you how to use it. There are videos online, but it's really just a muscle. It's like pressing on a knot in your shoulder. And it's
I'm
really
so
can be
getting
that
one.
simple.
I'm so getting one because
Wow.
that's when I went to my doctor here. She, I mean, I almost jumped off the table, Sarah, but I
Mm,
went for back pain. So I
yeah.
couldn't get rid of back pain. And my chiropractor finally was like, Jen, I'm sending you to Marty. I was like, okay, who's Marty? And then I'm like, it took me, of course, 2 months to make the appointment. I was like, I can't do this. I can't do this. I can do this. I can do this. But when she went in there and touched those muscles, I almost jumped off the table. They were so tight. And
Right.
it took 2 sessions. That was it.
Wow.
My back pain went away. Now I
Yeah.
still get back pain. We all do that. Not like that chronic, crazy back pain. So, what are some of the symptoms that you wouldn't associate to pelvic floor tightness or all of those internal muscles? What are some of the symptoms that we wouldn't associate with that?
So 36 muscles attached to the pelvis,
Oh,
including your back muscles, your hip muscles, your pelvic floor muscles, your abdominal wall. So we don't think about that all of those external layers can also influence the pelvic floor. So to your point, back pain, deep hip pain, abdominal pain, and period pain. Scar tissue restriction from your C-section scar can lead to incomplete bladder emptying, painful menstruation, constipation, and painful sex. Women who have a C-section actually have a higher risk of pain with sex than somebody who has a vaginal birth.
C-section.
Yeah. And then also, you even think about tailbone pain. The pelvic floor muscles attached to the tailbone. So that's another really common one. I would say some of the ones that really blow people's mind are like difficulty having orgasms because your pelvic floor is contracting and relaxing with an orgasm. It's also influenced with arousal. So the ability to have an orgasm, painful orgasms, peeing with sex. There's some women squirt, but some women also leak urine. And so having urine leakage during orgasms or sexual activity, peeing a lot before bed, it's something that I see in a lot of perimenopausal women, or waking more frequently at night to pee. Your bladder tissues and your vulvar and vaginal tissues and urinary tract change with estrogen levels, but you also have less muscle tone to delay bladder urges. And so, like things like hemorrhoids, fissures, fecal staining in the underwear, the pelvic floor muscles play a role in all of these things and may not be the
Wow.
only thing that needs to be treated, but they're definitely a piece of the puzzle that needs to be addressed.
One of your videos, you even mentioned frozen shoulder.
Frozen shoulder is due to is perimenopause and menopause. Yeah.
Yep.
And so
Wow.
it's influenced by the connective tissue in the joint. And so I'll have patients coming in for leakage or pain with sex and they're perimenopausal. And I start working on their neck and their shoulders, and they're like, I can't even put my bra on, or I can't lift my arm above my head to put something on the shelf, or things like that. Or when I roll over in bed, it's like sore when I lay on it. And I'm like, these are all signs of perimenopause that the frozen shoulder's a little bit easier to talk about, but I'm like, how's your vagina? Is it dry? Are you peeing more frequently? Do you have to use more lube during sex? Like, we need to dive deeper into these pelvic health issues, especially in this perimenopause and menopause conversation, because we see the bigger topics talked about, the brain fog, the hot flashes, the anxiety, which are so huge, but if somebody's like, hey, exercising regularly can help with anxiety, I'm like, but you're not going to exercise if you pee your pants. Or be having intimacy with your partner can help maintain good sexual health and orgasms. I'm like, you can't have sex if it's painful.
Yeah.
Or you can't travel if you're worried about where the next bathroom's going to be. And it's these kind of undercurrent issues that I think really influence women that we don't talk about.
Mm.
And it's that's what I see in my office is like the kind of deeper, more intimate issues that are there, but people don't talk about them so publicly, but yet they prevent us from doing so many things in our life that can really enhance our lives and bring us joy.
I think we could talk to you for 18 hours. And
I
we
could clearly
really,
talk about this
yeah.
for 18 hours.
I just looked at the clock and I'm like, oh my gosh, it's been almost an hour. And
Yeah.
we'll have to. And I was like, but I have 15
We
more
should let you
questions.
go,
I know.
but we don't
So
want to.
maybe we will try to organize another conversation with you. We can even ask our listeners for specific questions because that
Oh,
would be
sure,
really
absolutely. I'd love
interesting.
to hear what people want to know about, what hits, because I think that people are still connecting the dots. And then
Mhm.
there's another layer of, okay, what next? Okay, if I do have a problem, what do I do? And so,
Mhm.
again, I think that's really, we're at a time in our lives that I think we're able to talk more openly about this. I'm so grateful to be able to have this conversation with you and your community. But we still want to give women a menu of options, whether that's in-person therapy, whether it's online consults, whether it's a book, whether it's workouts at home, so that we can reach women where they are. We don't all have access to a therapist or resources, but I think women still really deserve this information. And I hope that's what Florid gives them.
So, Floored is an incredible book. I can't wait to get my hands on it. I loved what you said. Read the first chapter, the second chapter, or the last chapter,
Last
and then
chapter.
find the chapters that work for you. Because I'm not going to go read about prepping for birth. I'm not anymore.
Right,
Not going to do that.
right.
So I could see some people saying, "Oh, the book doesn't apply to me." No, it actually does. It applies to every stage of life, which is how we open this conversation. The other thing I wanted to highlight is the Beehive. That is a monthly prescription subscription. She gives you drugs and she gives you information.
Wish.
Me too. Sign me up. And it's only $30.
Right.
No, so it's 29.95 or something like that, $30 a month. And that gives you access to all of the current training and all of the future training and all of your information. There's so much content in there that you have contributed. And your blogs are great.
Thank you.
I think both Noelle and I have spent like over 3 hours like just on your content. Oh my
Oh my
gosh, oh my
gosh, that
gosh, oh
brings
my
me so
gosh, oh
much
my
joy. And I
gosh.
really, when I started this years ago, I was like, that's what I want. Like, I can go to a website and find everything I need to know about pregnancy or everything I need to know about maybe nutrition or gluten-free diet.
Mhm.
I'm like, where is this for our pelvic floor? And I really always, people are like, how do you come up with these ideas? And I'm like, people ask me. They're just like, hey, can you write a blog about this? Do you have a blog about this? Do you have a workout platform for perimenopause and menopause? So I was like, no, but I'll create one. And so
Mhm.
it's really just folks telling me what they need, and I hopefully am able to respond and give them resources. And yeah, it's just, I really love what I do, as you can tell. And I love being able to connect with other women like yourselves who are in this space. And I just really hope we can continue to help women at every age and stage take better care of their pelvic floors.
I love it. And how can they reach
Yeah.
you? Obviously, Instagram is the dot vagina dot whisperer,
That's
correct?
right. So
Okay.
on Instagram, I'm the Vagina Whisperer. On TikTok, I'm the Vag Whisperer because TikTok doesn't like the word vagina.
Oh,
And yeah, you can go to my website, thevaginawhisperer.com, where you can pre-order my book, and every book comes with 30 days of free access to the VHIVE, so you can get started your exercises right away, which really want people to be able to do and to see what pelvic floor exercises look like. It's not scary or weird, and there's so many videos on there just about the basics of peeing and pooping and sex and everything.
and it's not
And
just Kegels.
no, it's far from that. It's way
Yes.
far from that. And so, yeah, you can find me on all of those places. And yeah, I'm here.
Thank you. Best of
Thank
luck with the book tour and the launch. I know that's a big, huge deal. Congratulations. And we will definitely have you back because this has been extremely educational.
And thank you so much for your time. I know you're traveling, you have other things going on, but you kept this appointment with us to share with our audience. And I just so appreciate you and honor the work that you're doing. And thank you so much for your courage and strength and willingness to be like a loud voice in a quiet room. Thank you.
Thank you
Oh,
both.
Take care.
yay.
Oh my
Thank you
gosh, I want to
so
talk to you
much.
guys for hours.